Yeah, welcome. My name is Tumbwene Areas Mwansisia, PhD holder in psychiatry and neuroimaging from Central South University in China. Hereby I do apply for CNF fellowship for the year 2026. My proposal is on digitalizing mental health self-help interventions that is targeted to university students, mostly on managing anxiety and depression. Globally, mental health has been a leading cause for disability among youth. And the data shows that almost about 10 to 20% of youth are likely to have mental disorders that are diagnosable during that time. And it is much more unfortunate that lower and middle income countries, they are affected disproportionately, leading into more challenges. And one of the biggest reasons to why they have been in more challenge is because of the lack of resources, but of course also including the health facilities that cannot support the availability of the mental health services. In Tanzania particularly, mental health prevalence is much more higher, especially for depression and anxiety. While in the general population, depression is almost about 10%, but among university students, it is at 21%. This is the data from a recent study that have shown that the prevalence, it might have been increasing among university students. It is much more fortunate that even though depression is increasing, but the government has set some strategies to help university students, including each university to at least have a university counselor for mental health. And again, and I think that is much more important, that most university students, a recent study has shown almost about 75% of students, they have access to devices that can access internet. And despite of this availability of the supportive tools to support the intervention of digitalized mental health services, yet in Tanzania, there is a huge stigma for mental health services, and there is no available digitalized mental health services to university students. This is cause for the interventions to university students that will much more adhering to digital services, because most university students are likely to use internet, and they are likely to use gadgets that can help them to also access mental health services. So bearing this in mind, the study that I'm proposing is the study to digitalize mental health services to university students. And the plan is to have the study that will be sequential mixed method approach. In this study, we'll have the quantitative part that will be a starting part. We'll have almost about 30 in-depth interview. Through the interviews, we'll interview university students, faculty, the counselors, the dean of students, mental health experts, to try to build up on the services and understand the mental health perceptions and stigma among university students. After having this understanding, then we'll move to the quantitative study. The quantitative study that will also involve testing the effectiveness of the digitalized mental health services that will be digitalized through an app. And then after developing that, we'll move towards testing the feasibility, accessibility, and acceptability of the digitalized mental health services or interventions that have been developed. And we expect that in this study, we'll, as we test the acceptability, usability, then we'll also be testing on the efficacy. So at first we'll try to do the pilot of the interventions, and the primary outcome from that will be the reduction of anxiety and depression among university students. That'll be one of the primary outcomes. But also there'll be some secondary outcomes, including improving quality of life, including perceived performance in terms of academics, and also be including like stress reduction, like how this digital mental health services has reduced the mental health problems among university students. We'll also do a co-designing or co-creation of the intervention. So we'll do together with the university students, but also we'll invite the other stakeholders, including the counselors, the deans from the universities, the faculty, the mental health experts, and of course, including the ICT, thus will be helping us like how to digitalize this app, and of course how to make it culturally appropriate, and also testing like the usability, if it is really easily to get used among this university student. We are also targeting that we have a tool that will be using both languages. We'll use Kiswahili and English language for the access, because Kiswahili is most spoken in Tanzania, even though the academic language is English, but majority they are likely in their normal life to use Kiswahili. So that's why we use a bilingual tool that to increase the access and usability among university students. We have set a team of 4 of us, and then of course that's with the core team. We'll have other team that will work together. Me as Professor Tumbwene Mwansisa, who is a mental health expert, I will play key role on to developing the content for management of anxiety and depression. And we are expecting that the intervention will have almost about 80 modules covering issues like mental health literacy, on depression and anxiety, on stress management, on cognitive behavioral therapy. We'll also have a referral system onto the tool, so that if a person is having any challenge, and then after assessing the symptoms, if we feel like anything that it needs to have a psychiatrist, then within the app, within the intervention, there'll be also a referral system. And so I'll play a key role into development of the mental health component. But of course, as I said at initial point, this will be developed with the stakeholders through co-creation by using a human-centered design. And we have another colleague, Dr. Samantha from University of Alberta. I worked with Samantha. We have already developed a systematic review on the same, on digitalizing mental health services among university students. We developed this systematic review. So we have gathered initial understanding on whether the digitalized mental health app is really working. And we found that most centers most studies has indicated that digitalized mental health services is much more useful. It is likely to reduce stigma, is likely to increase access, and particularly to youth who are likely to face much more stigma or when it comes to accessing mental health services. So we have tried to work on the systematic review that we have already completed. We hope like we borrow this evidence that we have gathered from systematic review to use in this particular study. But also in this study we'll have Dr. Helen Maziku, who is coming from University of Dar es Salaam, and she is ICT expert, and she has been serving as the chair for human-centered design in East and Central Africa. So we have worked together in several projects related to human-centered design. So she's bringing in the 2 experts. She's bringing in the HCD approach, expertise, but also the ICT component on developing the digital mental health services through computerized or through software. But also we'll have Bernard Mtwiri, who is a scientist and epidemiologist, and who has worked in several projects. He will also be bringing in the scientific aspect in terms of data analysis and management of the data. We hope this project will be much more helpful to help the Tanzanians and of course go beyond our Tanzanian context, because such a digitalized app is most likely to make students access the services that they need the most, and that has been missing. Thank you very much.